Hi, this is Louis from ndxtesting.com. Now, this video is for technicians who want to learn about nerve examinations. Or maybe you're at the beginning stages of perhaps training, or maybe you're going to school and you want to have an idea about the NCV protocol. So what we're going to do with this video is we're going to discuss only the very basic nerve conduction study upper extremities protocol. And that way, when you start your training or you go in front of your instructor, you're going to have a very basic idea of what's going to be discussed. And then that way you can learn a lot faster. Now, with that being said, let's get started. Now, one of the things that you want to know is that all the nerves you have from your shoulders to your fingertips originate from the neck. So the neck is like the fuse box of the upper extremities. Everything originates from there. Another thing that you want to know is that every single muscle you have in your body, you have a nerve attached to it. And there's also motor reflexes when these nerves are tested. And have you ever had a neurological examination when they kind of tap you in the knee and you kind of respond? When we do nerve examinations and we test motor nerve components, there's going to be a response. Now, we're also going to test sensory nerves. Now, sensory nerves are responsible for touch and feel. So you have sensory receptors in your fingers and all over your extremities. So when you touch something hot, even before the brain knows it, you'll be able to react and move your fingers away from something that is extremely hot. But anyway, let's discuss the upper extremities protocol. Now, the nerves that we're going to test are the median motor nerve. Okay, maybe you want to take note of that. The median F wave, the median sensory nerve, the ulnar motor nerve, the ulnar motor F wave, and the ulnar sensory, and also the radial sensory. There's also a radial component, a motor component that later on, when you get a little better at performing nerve examinations, you have to know. But for this video and for the very beginning, what you want to do is become familiarized with the basic nerve components, and that is the median motor, median F wave, median sensory, ulnar motor, ulnar F wave, and ulnar sensory, and then the radial sensory nerve. Those are the main nerves that we're going to test today. Now, what do we use to perform nerve examinations? Now, obviously, we have a machine, we have a base unit, and we have a laptop that connects to that base unit, and we're able to perform nerve study. Now, what we do is we use electrical impulses. We have a stimulator. We have electrical impulses, so we can stimulate the nerves in the extremities, and then we'll be able to test to see if the nerves are abnormal or not. Now, the way we'll be able to tell if nerves are abnormal is by the shape of the nerve. Everything is shape in life. And we also look at the latency, which is the speed of the nerve. We also look at the amplitude, which is the height of the nerve. And we also look at the velocity, which is how nerve components communicate from point to point. But anyway, so when we start a nerve examination, usually we start with the median motor nerve. And we start at the level of the wrist. Okay, we start at the level of the wrist. So what we do is we use electrical impulses. We start at the level of the wrist. Now, what we want to do is communicate to the patient that we're starting at the level, we're starting with the intensity at 0. And then we're going to increase the intensity somewhat, a little bit. And all we're going to do when we do nerve studies is that we use the exact amount of intensity that patient needs for the nerves to depolarize or for the nerves to react. So we stimulate at the level of the wrist, and it's going to be a thumb response. And once we get that response, then we save it, and then we go on to the next site. The next site after that is going to be the nerve at the level of the elbow, right by the brachial artery. So what we do is we stimulate, we kind of press a little bit at the level of the median nerve here, and then we press, and then it's going to be a motor reflex. And of course, again, the objective of this video is to be familiarized with the protocol, not for you to learn how to do the nerve examination. Once you go in front of your instructor, they're going to kind of show you that. So I'm trying to keep things as basic as possible. Again, so when it comes to the median motor nerve, when it comes to the upper extremities nerve examination, you're going to stimulate at the level of the wrist. Okay, you start with the intensity at 0. You increase the intensity, and all you're going to do is use the exact amount of intensity that patient needs for the nerves to react. So you stimulate the wrist, and with the median nerve, you're going to have a motor thumb response. Okay, the response, the thumb will move all by itself. Then you come here by the brachial artery, kind of press a little bit. Notice that too, that the nerve here, your instructor will be able to go over this with you. The nerve is a little deep. So here at the median motor nerve, the median nerve at the level of the wrist is superficial. It's so superficial that I can make an incision, cut it, and pull out the nerve. That's how superficial it is. And that's why sometimes that nerve gets injured. And later on, when you get better, you're going to learn that one of the chief entrapment neuropathies of nerve studies of the upper extremities is carpal tunnel syndrome. You're going to learn about that. In fact, that's going to be one of your expertise, okay, diagnosing carpal tunnel. Anyway, so the nerve is superficial at the wrist, so you kind of just place the stim there, stimulate, you get the response. Here at the level of the brachial artery, you kind of press a little bit, you stimulate, and you get a nice motor reflex. And after that, you just kind of save it, and you take a distance, right? The instructor will go over that with you, and then you calculate a velocity. So here at the median motor, at the wrist, you stimulate, you're going to get a latency. You stimulate, you're going to get a latency, which is the timing, it's the speed of the nerve, and then you get a velocity, is how nerve impulses communicate from the wrist to the elbow. Okay. And once you get better too, you'll be able to stimulate at the level of the axilla. Okay. Or perhaps at the Erb's point or the clavicle. You can stimulate up to 4 different sites. Okay, wrist, the elbow, axilla, and then the clavicle here. But for now, we're just going to keep these 2 sites. Okay, so once you're done with that, then we're going to move over to the median F wave. Okay, the median F wave, later on, you're going to know exactly why we do F wave studies. But a very basic explanation is that the objective of the F wave is to get responses from the proximal pathways, meaning you're going to get a response from the neck at the lower part of the neck, and it's the C8 T1 nerve roots. Later on too, with the instructor, should be able to teach you the anatomy of the cervical spine. And so when it comes to the spine, there's 3 different levels. You have the neck, which is the cervical spine. You have the mid back, which is the thoracic spine. And then you have the lower back, which is the lumbar spine. You're going to have to be familiar with that a little bit, nerve roots. But when we do median F waves, it only gives us information about the C8 T1 nerve root. And then as you become a little bit better, that's going to play a very important role when it comes to your nerve examination. But for now, just know that the purpose of the F waves is to get some cervical responses at the C8 T1 roots, nerve roots, where when you do the median motor, you're getting key responses from the wrist and from the elbow right at the extremity. So anyway, we kind of discussed the median motor, wrist, elbow. You got the median F wave, gives us responses straight from the neck. So let's go over the ulnar motor. Now the ulnar motor, you're not going to stimulate at the middle of the wrist. You're going to stimulate at the side of the wrist, closer to the body, at the medial side here. So the median nerve is right at the center of the wrist. Okay, the ulnar nerve is at the side by your pinky. Okay, so same thing. We stimulate at the level of the wrist. Okay, usually with that, then the last 2 fingers are going to move a little bit. So you stimulate there, you save the response. You're going to get a latency. Again, you're going to be familiarized with the shape of the nerve and the latency of the nerve, the amplitude, which is the height and velocity. Now, again, you stimulate the level of the wrist, and also you stimulate at the level of the elbow. The funny bone is at right above that a little bit. And later on, when you get better too, you're going to learn how to diagnose that called ulnar nerve neuropathy. Now, remember I discussed the carpal tunnel here at the wrist, but you know what? I'm not going to confuse you too much with that. I want to keep this as basic as possible. And I'm going on too long. I don't want this video to be too long, maybe 5-7 minutes. But anyway, ulnar nerve at the wrist, and then you're going to stimulate above the elbow, collect just 2 responses, and then calculate a velocity, and you move on. Now, just the same way you have the median F wave, we're going to have the ulnar F wave. Same thing. We stimulate at the wrist, and with the F wave, we're going to get neck responses at the same level, C8, T1. But anyway, oh, you know what? I kind of forgot to mention that obviously, when we stimulate, right, we also have electrodes. Okay, the median nerve, the electrodes go at the APB muscle. Okay, so we have an active electrode at the muscle, and then we have a reference electrode at the thumb, or you can put it at the pointing finger. But in this video, we're going to discuss at the thumb. Okay, median nerve, median motor nerve, electrodes at the APB muscle here, close to the thumb, and then at the thumb finger here. Okay. Anyway, and your instructor is going to go over that, just so you have an idea that we are going to have electrodes. And then for the ulnar motor, then we're going to have electrodes here at the EDQ, ADQ muscle. Okay. The instructor is going to go over that with you too. And then we're going to have an active electrode and the reference electrode. And then we also have a ground. The purpose of the ground is to kind of have the waves stable a little bit. Listen, sometimes I have not even used a ground, but obviously most of the time, 99% I use the ground. But that's just to keep the waves somewhat stable. If you don't have the ground, the waves are going to be all over the place. So the ground is really, really important. And if you're working in a hospital, sometimes things can get really messy there. So you're going to have to play with that ground. If you work in an environment where there's no noise, then and that's what the thing. The ground is to be able to prevent noise. So you want to be able to use that. So with nerve examination, you're going to have your stem with your stem. You're going to have an active electrode, okay? And you're going to have a reference electrode. You're going to have a ground. Anyway, but the instructor is going to show you that. The purpose of this video is for you to be familiarized with the protocol. Anyway, so we have median motor, okay, median F wave, ulnar motor, ulnar F wave. So now let's discuss the median sensory. Now the median sensory, it's a little different. We're going to stimulate the same place where we stimulate at the median motor, but we're going to have electrodes at the pointing finger. Okay, active electrode. Reference electrode goes closer to the fingernail, okay? And then the ground, you can put it anywhere around the hand. When we stimulate, sometimes, usually your instructor will teach you how to record just one response, and once you get better, then they'll teach you the purpose of recording 2 different responses, okay? So then you got the median sensory nerve. Then after that, you have the ulnar sensory nerve. Ulnar sensory nerve, you stimulate the same place where you stimulate for the ulnar motor. The electrodes, of course, go at the pinky. You stimulate, you get 1 response. Radial sensory, which is the last wave, the last nerve that we're going to test. Now that's you put the active electrodes above the thumb. There's a notch here by way above the thumb by the wrist called the snuff box. You put the active electrode there, and then you put the reference at the tip of the right before the fingernail, and you're going to stimulate about 14 centimeters above that active electrode. It's a very simple procedure, and your instructor is going to show you that. But the purpose of this video is so you can have an idea of the NCV protocol, and as you get better, then it will get deeper. The objective is, of course, is to be able to communicate with your patient as far as what you're going to do, and go over all the medical history. Also, when you communicate with your patient, you have to sound nice and versed and know exactly what you're talking about. Explain the nerve examination as best as you can, and then, of course, if you assistant the doctor when it comes to electromyography studies, which is the EMG, then you're gonna have to communicate that. But anyway, with that being said, I hope you were able to find this video helpful. Now, this is the first video that I'm going to do when it comes to upper nerve conductions. I'm going to do a lot more, but this is just a very basic one, and I'm actually recording this for a friend. She's starting to train in nerve studies, and what I'm going to do is kind of put as many videos in this YouTube platform, and that way she can be instructed. She's going to be training with someone who's been working with me for about 10 years. She's extremely good at what she does, and I guess maybe with some video training and some physical training, then she'll be able to learn as much as possible. We're definitely going to need her to come on board for the company. Next video, we're going to discuss the lower extremities protocol, and maybe I'll redo this video. It's kind of late at night. I'm extremely tired. I got to wake up early and see a bunch of patients, but it's a good thing that I didn't have to work today, so I was able to do a few things and trying to get the right lighting in here. It's not easy to record these videos, but hopefully it was as helpful as possible. With that being said, I'll see you next video. Bye bye.